We're going to get started on Tuesday. And it's going to be fun because I did not practice. And you know how Tuesdays go. Tuesdays are written by our medical students and our medical resident. So they'll always use some really fun big words. And usually I go to Google pronounce or pronounce on whatever's on the internet, and I practice it. And I have like little post-it notes on how to say words. Didn't get a chance to do that today. So actually this post is from Samantha. So she really hopes everybody had a great Memorial Day weekend. Adam is actually preparing for his board test, so we all wish him good luck. I think he just finished all of his finals as he ventures into his 4th year as a med student. And last week, Duke, our resident, because of course he graduated, now he's a resident, was explaining about diuretics and mentioned a few of the medications. And we've been kind of slowly going through these. And the reason we've been focusing on diuretics is because they really help with, for people who are retaining fluid, people who suffer from edema, that swelling. And it's that time of year. It's going to be hot. It's so hot in the West. I can't believe they're having average temp of, what are they like at? Somebody hit 111, I think, today. That's insane for the beginning of June. So with all the heat, diuretics become really helpful in helping us shed and lose some of that excess fluid. So we talked about a drug last week, and this one we're going to talk about furosemide, which is more commonly known as Lasix. Okay, so Lasix is actually the brand name for furosemide. So much easier to say Lasix than to say furosemide. But it's a very potent diuretic, and it belongs to a class of drugs that are known as loop diuretics. And this basically works by inhibiting the reabsorption of sodium and chloride in the kidneys, specifically in the loop of, I think it's pronounced Henle, I'm going to guess, could be pronounced totally differently. And I'm assuming that this is an area of your body. I'm just reading it. I'm not a doctor. I'm just sharing the info. So this action of helping to inhibit the reabsorption of sodium and chloride actually increases the urine production, and it helps to remove excess fluid from the body. So why would Lasix be chosen as a prescription for people who have aortic disease or heart disease? So it helps to manage hypertension, and patients who have had an aortic dissection or other aortic disease often have hypertension. That's why we're on a lot of these beta blockers, right? And this is a significant risk factor that can exacerbate these conditions. By reducing the volume of fluid in the blood vessels, Lasix actually helps to reduce your blood pressure and thereby decreasing stress on the aorta. That's how everything goes hand in hand. Reduce the volume of fluid, it reduces your blood pressure, and it reduces the stress on the aorta. The other things that Lasix can do is it reduces fluid overload. So in heart disease patients, particularly heart failure, so for people who have heart failure, the heart's ability to pump blood efficiently becomes compromised. And this leading to fluid buildup in the body, we don't want that. So this can result in symptoms like edema. We talked about edema means swelling, and it can also lead to pulmonary congestion. Lasix helps to alleviate all of these symptoms by removing excess fluid, improving your breathing, and by reducing that swelling. It actually prevents pulmonary edema, and that's going to be swelling that's going to be in your lungs. So patients with severe aortic or heart conditions are at risk of pulmonary edema, where the fluid accumulates in the lungs, and Lasix is pretty critical in managing or preventing this condition, ensuring that patients can maintain adequate oxygen and respiratory function. Learn something new every day. Now, this doesn't mean that this is the appropriate diuretic for everyone. So this is where it becomes interesting. And we talked about this last week. Not every prescription works the same way that's in the same class. So you can take a different beta blocker and you may not have the same side effect as the one you were originally on. You can take a different diuretic and it's not going to have necessarily the same effect or necessarily be correct for you. So these are the people that should not take Lasix. People who have, and I'm going to butcher this word, I feel confident, severe hypovolemia or dehydration. See, why can't they just stick with dehydration? Why we got to go into like a multi-syllabic word? Severe dehydration. So when you use Lasix in people who are severely dehydrated, or have low blood volume, this can actually exacerbate conditions leading to dangerous drops in blood pressure and further complications. So, if you're somebody who has or you're experiencing a sudden lower blood pressure, I probably would recommend making sure your doctor is aware of this before you would take your diuretic. Have this plan with your physician. What do I do? What is too low? Do I still take it regardless? If you're feeling a little dizzy when you stand up and you're taking it, I would also definitely let your physician know because you could be experiencing lower blood pressure. And then when you release all that fluid volume, it's lowering your blood pressure again. And that could be part of any additional side effects you're feeling. This is where communicating, thus advocating, comes in really handy. Also, people who have an electrolyte imbalance. If you have a significant electrolyte imbalance, such as hypokalemia, low potassium levels, big word for something simple, you probably should not use Lasix without correcting the imbalance of potassium, as the drug can actually exacerbate this. And I know there are some diuretic medications that say potassium sparing. So it prevents an excessive loss of potassium when you're losing the fluid. That's how I'm assuming that it works. So again, you'll be having all these conversations with your physician. If you have hypersensitivity to furosemide or to Lasix or sulfonamides, that sounds good. I think it sounds good. You should avoid this medication due to risk of severe allergic reaction, but I would assume that you would share with your physician if you have hypersensitivity, so this way you're not prescribed this particular loop diuretic. So here's some of the potential side effects of taking Lasix or furosemide. Electrolyte imbalance. Okay, it's common side effects to experience hypokalemia, hyponatremia, low sodium levels, so low potassium and low sodium, and hypomagnesemia. Low magnesium, low potassium, low sodium. These imbalances can actually lead to symptoms like muscle cramps, fatigue, heart arrhythmia. So if you're feeling all of those things, you could be like off balance when it comes to magnesium, sodium, or potassium. But you definitely want to communicate these types of things that you're feeling if you're on a diuretic. Hey, communicate it even if you aren't a diuretic. Dehydration and hypovolemia. Hypovolemia sounds like low volume. I just put the two words together. It just clicked in my head. Did you see that moment, Joshua? Did you see my wheels were like hypovolemia, volume?
I always watch when your wheels are turning, Karen. Always.
Okay. Well, they were spinning right there. I was going. All right. So overuse can cause excessive fluid loss. So leads to dehydration, low blood volume, which can result in dizziness, fatigue, kidney dysfunction. I know a lot of women say often, especially during certain times of the month when they're retaining fluid, I wish I just had a diuretic. I could easily drop 5 pounds. But you don't want to overuse diuretics, and you shouldn't be using them for that particular reason. The fluid loss, yes, but as a weight loss contributor looking to see pounds come off the scale, that's not what you're using this for because it's not true loss. It's water weight loss. You got to put that back on, right? So don't overuse, don't misuse, take it as directed. It's really important. You don't want to end up dizzy. You don't want to faint. Ototoxicity, tomato, but it's that word. And you know what that word means? High doses of rapid intravenous administration of Lasix can actually cause hearing impairment or tinnitus. Tinnitus? Tinnitus. Tinnitus? It's ringing in the ears. That's what that really special word means. And the side effect is usually reversible, but can be permanent in very severe cases. So again, if you're sensing any kind of odd sensation, feeling you're not used to, it could be a side effect. You want to let a physician know. Okay, hypotension, significant drop in blood pressure. Hypertension, when we have an increase in blood pressure. So you can experience hypotension, particularly in patients who are also on other antihypertensive medications, such as a beta blocker. And I'm sure there's other medications, but I'm not a physician, so I don't know all the other ones that might impact this. Hyperglycemia. Lasix can actually raise your blood sugar. That's hypo would be reduce it. So this could be problematic for diabetic patients. So I'm sure if you're a diabetic patient, you probably were not prescribed a loop diuretic or certain diuretics in this case, because it could actually raise your blood sugar. So furosemide is actually a critical medication for managing fluid overload and hypertension in patients with aortic and heart disease. However, it does require careful monitoring due to its potential side effects and contraindications. Ensuring proper patient selection and regular monitoring can help maximize the benefits of Lasix while minimizing the risks. There's always going to be a risk involved with pretty much any medication that I know of, right? If you take it too much, you misuse, there's always going to be risks, but always consult your healthcare professional before starting or stopping a medication. And also, if you're feeling something off, you want to let them know, because that could be a side effect and then they can make adjustments. So this information presented by our med students, as always, is basically used to provide general awareness and definitely should not replace professional medical advice. So that was it for this week. She says, thanks for letting her take over Tuesday, because she's typically our Monday post. And she said, keep an eye out for today's Medical Monday post, which is out. It all has to do with the diuretic again, another one. So yeah, that's your topic Tuesday.